Healthcare institutions in Singapore are stepping up training for youth volunteers to take up paraclinical roles as part of a growing shift towards preparing them for specific skill-based duties that support frontline care. It's hoped this will widen the talent pool for future healthcare practitioners. Chloe Teo tells us more.
When your patients are facing the final stretch of their lives, what keeps you going? For one youth at a Sissy hospice, it's deeply personal.
When my dad was diagnosed with cancer when I was 11, I was exposed from a young age to the importance of connection, empathy, and emotional support during times of crisis. And so I really decided to serve in a hospice because the experience drew me closer to palliative care.
Volunteer numbers at the hospice have grown steadily to about 520, with youth accounting for nearly 40% of the pool. In recent years, the centre has extended the training volunteers receive to include clinical skills like how to feed patients who have difficulties eating. It's a move that has helped to ease the workload of its staff.
Our volunteers actually train to support our nurses in a lot of service-based delivery of care for patients. So that includes even things like, diaper changing, sponging of patients to keep them comfortable and clean, and like we mentioned, the unhurried companionship which they appreciate.
One hospital says it's using this momentum to develop a future pipeline of healthcare professionals through skills-based programs featuring structured learning pathways.
We are now looking at how care is going to be redesigned and how roles are going to be redeveloped for the professional workforce and also the informal workforce.
This includes paraclinical programs, for example, volunteers helping out at the pharmacy. The programs are also aimed at equipping participants with transferable skills like caregiving that they can bring back to their communities. But another hospital also notes challenges retaining these youth volunteers as they transition between life stages and shifting priorities.
We have weekend programs on Saturday and Sunday, so the volunteers who come making on weekdays, they still have programs to contribute. If we let them exercise a lot of flexibility in terms of reporting for their duty, during term break, they can come more regularly. During exam period or when term paper is due, they will take a pause. So that's one of the flexibility that we have to put in if we want to retain the volunteers.
With more youngsters on board, hospitals are now eyeing another group, seniors who can offer not only time on weekdays, but also the ability to communicate in dialects.